You are welcome this morning to indeed this important discussion towards zero pollution, measuring citizens' health and well-being. We will be discussing that and the various implications. You can join us online by using the hashtag HealthyEurope or hashtag WellBeingForAll, because we do want you to join in the conversation today. We have a couple of keynote addresses for you from the European Parliament and from the European Commission, and then we will go into a discussion where we have some excellent panelists waiting to answer your questions. So I am switching on the Q&A function. Do please get those thoughts into us, and we will then also be having a chat about what we can do and how we can move forward. But with that, let me first say that we're delighted to be partnering with the All Policies for a Healthy Europe. And we're going to start now with Commissioner Virginijus Sinkevicius, who is joining us live this morning. Thank you very much, Commissioner. I'm going to hand over to you to tell us why you think this is so important and what set out the parameters of what we need to discuss today.
A very good morning to everybody, and of course I hope you can hear me well. And of course, thank you for this very timely invitation. It's almost exactly a month since the Commission adopted the Zero Pollution Action Plan for air, water and soil. And events like this one clearly demonstrate the level of interest, and this is one of the last overarching building blocks adopted under the European Green Deal. Together with the chemical strategy for sustainability adopted last year, it shows how we plan to translate the zero pollution ambition for a toxic-free environment into action on the ground. And the COVID crisis seems to be abating, and it's taught us many things. It was a reminder of how our own health is connected to the health of the planet. And we have developed the COVID vaccines, but there is no one miracle cure for pollution. 1 in 8 deaths in the EU is linked to environmental pollution, and 90% of these deaths are due to chronic diseases, most frequently cancer. And the situation is socially inequitable, with vulnerable groups suffering the most. That means children, people with medical conditions, older persons, and persons with disabilities, and people living in poorer socio-economic conditions. The health of the planet is also under threat, and pollution is one of the 5 main drivers of biodiversity loss and ecosystems degradation, which is threatening the survival of more than 1 million species, but also our own. And these negative impacts are expected to worsen unless we manage to change. And that, of course, is why we are here. I'm sure we all recognize the moral obligation to do better and to radically increase the level of environmental ambition. Our vision for the zero pollution ambition is that by 2050, we'll live in a toxic-free environment. It is the aspiration we strive for, recognizing that to get there, we have many challenges to tackle along the way. But what's clear is that to reach levels that are no longer harmful for health and natural ecosystems and respect the boundaries of our planet, we must start now. And I'm absolutely convinced that we can get there, provided we have certain conditions in place. One of them is putting all efforts to better implementing our existing environmental legislation, but also identifying gaps and closing them as necessary. For example, as announced, we are reviewing the standards for the quality of water, including in EU rivers and seas, and for those of air, as well as tackling harmful substances in consumer products. All this with the objective to better protect our citizens' health in mind. But another essential element, the topic of this roundtable, is setting up an adequate mechanism to track our progress and to take environmental monitoring and outlook to the next level. We can't manage what we can't measure, and especially identifying emerging concerns, but also possible integrated solutions. We are already doing quite a lot of measuring. We collect a lot of piecemeal data on pollution, but we rarely see the big picture. Often we also miss to consider the overall costs to society through its impacts on health, for example, but also the possible win-wins of solutions that we can put forward. Pollution data and also health data, in fact, are often dealt with by many different actors at the national, European and international level in a fragmented way. We need that synthetic overview and also better integrated information. And that's why the Zero Pollution Action Plan plots out the development of an integrated monitoring and outlook framework as an integral part of the 8th Environment Action Program. The details are set out the staff working document that accompanies the action plan. It also sets out our intentions on how we want to develop this monitoring with all partners inside and outside the institutions. We have started planning the work and identifying areas where we need to step up our efforts so that the monitoring and the outlook generate information that's timely and relevant for policy. We can already see, for example, that soil pollution monitoring needs to be developed further, but we also need to make better use of this information in all relevant policy areas. For example, as announced in the action plan, we want to ensure that the cancer inequalities registry and the atlas of demography are regularly fed with pollution monitoring and outlook data, or that the performance of regions and cities is better collected and communicated to spur pollution reduction across the different branches and levels of government. And very importantly, we need to properly implement the polluter pays principle, as the costs of pollution are today still most often borne by the whole of society and especially the most vulnerable. And I'm confident that this monitoring and outlook framework will deliver the goods. It will take us closer to one of key ambitions in the Zero Pollution Action Plan, giving us a compass to mainstream pollution prevention in all relevant EU policies, stepping up implementation and identifying possible gaps. I said that pollution was a matter of social equity. We really need to keep that in mind. This is the beginning of a battle for a healthier, fairer, and more equal future. And that's a battle we can't afford to lose.
Thank you very much, Commissioner. I mean, you're absolutely right. It is a battle we can't afford to lose. And I'm very impressed that you mentioned the COVID as a sort of wake-up call. Just a quick follow-up question. Do you think that has fundamentally changed our approaches the last year or the last 18 months?
I think it definitely gives a different perspective. We saw that, first of all, of course, I don't want that the message that such thing as pandemic, as COVID, such a horrible thing, what happened is the way to fight pollution. It's not, but it gave us a definitely different perspective in certain cities to see that without traffic, with the decrease of air pollution, people can breathe easier, better, and of course that has an impact on our health, on our well-being, and most importantly, I think with this pandemic, everyone perceived nature a bit differently. Everyone saw nature as a sort of safe haven where you can return, where you can relieve, and so on. And I think this gives a good opportunity window for politicians, for decision makers, not only at EU level, but national governments, regional governments, to act and take decisions which maybe they were afraid to take off, not to take, let's say, away a comfort from certain groups of people. I think this is a good moment.
Well, thank you for that. And I know today we're just talking about Europe specifically, but obviously you can't fight pollution on your own. Have you any big hopes for what's happening at the G7 and so on? I mean, this need that it has to be a global effort.
Absolutely. Pollution respects no borders, and we cannot expect ourselves, to successfully fight pollution, but leaving, countries which, first of all, are neighboring countries across the EU border to stay in the same situation. We have to help them as well. And I think there is multiple positive ways to do so, and with our investments abroad, if we manage to export our plans of, for example, renovation wave, people will see a positive change. The positive change they first of all see in their heating bills, but secondly, shortly they will feel a relief in their lungs.
Appreciate you taking the time. I think it speaks to how important this issue is that in your busy schedule you took time out for us this morning. So thank you very much, Commissioner. We're going to turn now to a message from the European Parliament, specifically from MEP Sarah Sherdas, who is on the BECA committee and Vice Chair for the Environment and Vice Chair and also on the Environment Committee. So let's have a look at what she has to say.
Hello everyone, and thank you for all policies for a healthy Europe.
Sorry, when the Commissioner's sitting there.
It's an utmost pleasure to be here with you. My name is Sarah Sherdas. I'm a member of the European Parliament and a medical doctor in the field of public health. It is quite important to understand what this pandemic unveiled and the persistent threats that exist to the health of our planet calls for urgent matters too. And we must not forget that we were in an emergency even way before this SARS-CoV-2 struck us. We have the climate emergency, environmental pollution, biodiversity loss and unsustainable use of the resources pose multiple risks to the human, animal and environmental health. Hence, my pledge in the European Parliament to have a one health approach and health in all policies approach in the policies that we do, not only in the ENVI committee, but all across the Parliament. There is an urgency to act. Pollution is indeed a cause for many diseases and pathologies, and it's quite correlated as a risk factor for most of non-communicable diseases. But it is also one of the main drivers for communicable diseases, such as those diseases that are vector-borne. So all impacts in the ecosystems will have an impact also on infectious diseases. For this, I highly salute the zero pollution ambition that the European Commission has presented. This is a cross-cutting objective to contribute to the UN 2030 Agenda for the Sustainable Development Goals and will complement the 2050 climate neutrality goal in synergy with the clean and circular economy and restored biodiversity goals. It is part of the European Green Deal, and the main objective in this is to include pollution prevention in all relevant EU policies. So, in order to steer the EU towards the 2050 vision for a healthy planet for all, this action plan has intermediate targets to speed up pollution reduction, such as reducing by 55% the health impacts of premature deaths by air pollution, by 30% the share of people that are chronically disturbed by noise pollution, by 25% the EU ecosystems where air pollution threatens biodiversity, and by 50% nutrition losses with the use and risk of pesticides and more hazard ones, and the sale of antimicrobials for agri and aquaculture. So it's of the importance to achieve these goals, to have these goals, to achieve these goals, but for this to be a reality, we need to develop work in a very articulated and cooperative way between all the different sectors, all across the member states, but also with the regions and with the cities. And I would like to highlight some important instruments under this ambition that will be a reality. One of them is the Climate Health Observatory. We are now being stricken by more frequent and intense extreme weather events, such as heat waves or cold waves, wildfires, floods and landslides. I come from a peripheral country, Portugal, and I am from an outermost region, Madeira. So we are more susceptible by these types of events, and we need to make ourselves more resilient. And under the banner of keeping healthy in a changing climate, the European Commission and the European Environment Agency launched the European Climate and Health Observatory in March 2021. This new observatory aims to co-create, connect, pool and provide knowledge, expertise and tools required to tackle the health challenges related to climate change. So this is good news for us all involved in the fight against climate change and its effects in health. And this observatory also supports the EU Green Deal. Another initiative is the Living Labs for Green Digital Solutions and Smart Zero Pollution. This has been launched in 2021 by the Commission, and this is to engage with regional and local authorities and other stakeholders with the main goal to help develop local actions for green and digital transformation. So we're going to achieve our goals not only in the climate transition but also in the digital transition. A clear example of how to think global and act locally. Another initiative is the reduction of health inequalities through zero pollution, and with this objective in mind, from 2022 onwards, the Commission will ensure that there will be a new announced cancer inequalities registry and an atlas of demography, and that will be regularly fed with pollution monitoring data. So by 2024, we will have an idea, an overview of what are the trends, the disparities, the inequalities across EU regions, because it's only when we understand the data that we can act on the information the data gives us. So just to conclude this short introduction to this very important initiative, the Zero Pollution Action Plan comes in a time where the European Union has set itself the target of achieving climate neutrality by 2050. We must not forget that we always need to have in mind the health and well-being of our population. And indeed, with this initiative, with this action plan, we're going to have lots of tools in order to help us to put in march our vision for a pollution-free world. So now it's really and truly the time to act and deliver for a healthier world. Thank you very much.
And indeed, thank you. A very, very warm and grateful welcome to members of the European Parliament for getting in touch and joining us today. I mentioned at the beginning, of course, that we are partnering with All Policies for a Healthy Europe coalition today. So let's have a brief look now at a video giving us some background information.
70% of Europeans want to see more action at EU level on health and well-being. Our mission is to position citizens' health and well-being at the centre of EU policy making.
We need to better tie health measures to other linked areas such as the environment, climate, digitalization, food and nutrition, pharmaceuticals, and this will be precisely the focus of our synergies within the Commission.
All Policies for a Healthy Europe is an intersectoral initiative that brings together a diverse group of NGOs, think tanks, associations, companies and individuals. We champion a broad and bold vision for health and well-being and see health and well-being as catalysts to a stronger economic model. We seek opportunities for collaboration beyond the healthcare sector. All Policies for a Healthy Europe is keen to support the European Commission's vision for a healthy, climate-neutral, socially inclusive Europe.
Well, as you can see there from that video, it is an ambitious aim. And of course, there's a lot of great knowledge going into this. It's very much science-led with a lot of knowledge partners. And we're going to hear now from Sophie Rasmussen, who is the Vice President for Essential Health and Sustainability in Europe, Middle East and Africa at Johnson & Johnson Consumer Health. So let's hear from her. Of course, all led by the science. We hear Johnson & Johnson a lot at the moment because of their great work on the vaccines. But of course, it's broader than that. It's about all health.
Hi, I'm Sophie Rasmussen, Vice President for Essential Health and Sustainability for Europe, Middle East and Africa at Johnson & Johnson Consumer Health. I am delighted to join this important event as an All Policy for Healthy Europe corporate knowledge partner to discuss a topic which we have at heart, the essential link between human health and the environment. As the world's largest healthcare company at Johnson & Johnson, we know that human health is inextricably linked to the health of the planet. Healthy people need a healthy planet. And that is why we have accelerated our commitments and actions towards sustainability, announcing our next generation of global climate goals. We will source 100% of our electricity needs from renewable sources by 2025. We will achieve carbon neutrality for all our operations worldwide by 2030. And we will reduce our upstream value chain carbon footprint by 20% by 2030, engaging our suppliers to help us reach this goal. At Johnson & Johnson Consumer Health, serving 1.2 billion consumers with products rooted in science, we are uniquely positioned to help our consumers and employees live healthy through their whole life. In 2020, we launched our Healthy Life mission, our ambitious agenda to advance human health while also protecting our planet. And we are investing $800 million over the next 10 years to advance initiatives in 3 core areas. Number 1, our product portfolio. Number 2, our operations. And finally, number 3, partnerships, which we will fund to have a broader societal impact by 2030. We are evolving the way we do business, from designing products with the health of the planet in mind to tackling sustainability at all levels of our supply chain and improving product transparency, beginning with ingredients so our consumers have the information they need when choosing health products for themselves and their loved ones. Across our product portfolio, we set tangible targets to make our packaging easier to recycle or reuse. By 2025, our brands will achieve 100% recyclable, reusable or compostable plastic packaging and 100% certified or post-consumer recycled paper and pulp-based packaging. By 2022, we will eliminate polystyrene and black plastic containers from our global portfolio and expand our reuse models across our portfolio of brands such as Johnson's, Aveeno and OGX. We are already making tremendous progress. A few examples. And in 2021, this year, Johnson's Baby will shift from pumps to caps on many lotion and wash products, eliminated 30 million impossible to recycle pumps from landfills every year. Operationally, we're driving sustainable change at our facilities and through our people and our extended value chain to support our goals. The Johnson & Johnson Consumer Health Factory in Helsingborg in Sweden became J&J's first ever facility to achieve CO2 neutrality for all energy sources across manufacturing, warehousing and R&D facilities in 2017. This year, the plant has been recognized by the World Economic Forum, earning lighthouse status for applying 4th Industrial Revolution practices that can serve as a model for all manufacturers and supply chains across the globe. While we know that no one company or government will have all the answers to the great public health and environmental challenges of our time, we're committed to collaborating with partners to learn, understand, share knowledge, expertise and innovations to build a healthier future. Which is why we value the power of partnerships and collaborations like this one to transparently contribute to the public debate and help drive systemic change at scale. As a coalition, All Policies for Healthy Europe strives to foster knowledge sharing, best practices and science-based policy recommendations towards putting people's health and well-being at the center of all areas of EU policy making. We would also like this event to be an opportunity to identify the challenges and knowledge gaps that still lie ahead in order to guide our coalition's action and work for the future. Thank you for joining us for this exciting session.
Well, thank you very much. I think we've heard from the Parliament, the Commission, and indeed the knowledge partners about why today's event is so important. So it is now time for me to introduce you to our panellists. Our speakers today are very knowledgeable, and we're really going to hope to get the best out of them. So do remember to use the Q&A function to ask your questions. So with that, let me introduce Alexandra Kazmierczak, expert on climate change and human health at the European Environment Agency. We also have Žiga Žanek, who is the head of country reviews, SDGs and impact measurement at OECD WISE Centre. Jasper Kluwer is the Director of Sustainability at Philips, and Maria Fernanda Cabrera is the Professor at the Universidad Politécnica de Madrid and coordinator of the Horizon 2020 Pulse project. Thank you all very much for joining us today. We really do appreciate it. Let's just have a quick tour de table. You have a minute or so just to set out your stall, tell us what's important and to highlight your key messages. Alexandra, I will let you go first.
Good morning, everyone. It's an absolute pleasure to be here today. And I would like to talk about the European Climate and Health Observatory, and the MEP, Sarah Czerdasz, already very kindly introduced the initiative. So I just would like to reiterate that it's a recent initiative of the European Commission, European Environment Agency, and a host of other partners aiming at improving our knowledge on climate change and health. It is a recognized gap. It is a huge problem for our society, probably the biggest health risk in the long term. And the aim of the observatory is to pool the knowledge, the expertise, and the resources of the organizations involved in the either climate change work or health work, or both, in recognition that not a single organization can resolve this problem. So only by working in partnership and pulling together our knowledge, resources, and expertise, we can provide the knowledge that can support effective policy making and implementation of actions protecting people from the impacts of climate health. More to come later. Thank you.
Thank you indeed. Lots more to come. Žiga, let us hear a little bit about your position.
Thank you very much. It's a great pleasure to be here with you. So I'm coming from the WISE Center, and I'm actually heading the work on the impact measurement and SDGs. So my focus would really be on importance of measuring. If you want to manage it well, you have to also measure it well. But sustainability has been at the heart of what the OECD is doing since its inception in 1960. And sustainability not only with respect to non-inflationary type of macroeconomic idea of it, but also taking into account very closely environmental issues, taking into account people, what it really matters for them. So since then, we've been developing frameworks, data, indicators, and most recently, we provided a very consistent approach to bringing together both, on one side, inequalities and the environmental issues in the report that we call the Environmental Nexus. And this is really sort of our blueprint of steering discussion and work towards a people-centered green transition. So now that we are hopefully going out of the COVID, we really need to think carefully, how do we build back better? So basically to combine the short-term impact that we've seen materializing both on how people live their lives, but also on the environmental issues, with a longer-term trajectory reaching towards the 2030 agenda, different SDG goals as well. So perhaps I will stop here. This is enough for introduction, but very happy to iterate on several points later on as well. Thank you.
Thank you indeed. Jasper, give us the viewpoint from Philips.
Good morning. My name is Jasper Kluwer. I'm Director of Sustainability at Philips. Philips is a leader in health technology. We provide innovative solutions that promote health and improve healthcare delivery. Let me share one example of our environmental commitments. Already last year, Philips achieved carbon neutrality for our own operations. But as part of our next commitments, we will further reduce CO2 emissions in our entire value chain. So that includes also the impact in the use phase of our products. This is in line with the science-based targets of having a 1.5 degree global warming scenario. So I'm super excited to be here today. As a health technology company, we recognize the trend of rising chronic diseases such as heart disease, cancer, and respiratory conditions. And we also observe global resource constraints. So we really need a focus on prevention and population wellness. Zero pollution is a strong enabler for improving health and wellness. So I'm again happy to be with all of you at this event. Thank you.
Very good to hear from you, and well done on achieving that goal. Maria, last but not least, tell us what you're working on.
Thank you so much. Good morning, everybody. It's a pleasure for me to be here today to give you also some insights of the work that we have carried out within the PULSE European project. I come from the university. I am an innovation director of a research group called Life Supporting Technologies, whose mission is to contribute to the process of digital transformation of health, using the power of technologies and data for patient care, disease prevention, and personalization of treatments to contribute to the improvement of the quality of life of the citizens. And together with a consortium of 12 partners, we developed PULSE that aim at promoting both air pollution awareness and healthy habits to reduce health risks in 7 pilot cities around the world, initially Barcelona, Paris, Birmingham, New York, and Singapore, and later in Pavia and Kilan. So I'm happy to share with you more information during this panel. Thank you.
Thank you very much. I'm sure I will come back to you because I was struck by what the Commissioner said at the very beginning about how sometimes piecemeal data misses the bigger picture. So I'm sure that's something we want to talk about in a bit more detail. But Alexandra, let me start with you. You mentioned the importance of partnership and knowledge sharing when it comes to bridging the gaps, again, mentioned by our keynote speaker, regarding the impact of climate change on health. So can you give me some examples about how this works in practice?
Yes, of course, just to start from the fact that Observatory is still a baby. It was only born about 3 months ago, so we are still learning by doing, developing the partnership and just getting into the stride of things. But some examples of the successful partnerships we've developed are, for example, with the Lancet Countdown Group. It's a group of worldwide academics and researchers specializing in climate change and health. And we've worked with them by supplying them with European data and adjusting slightly the indicators that have been developed for the global situation to the European conditions in order to reflect the situation in Europe as accurately as possible when it comes to the modeling and projections of climate change impacts. And this set of indicators is available on the Observatory website. Another type of partnership we have is with the Copernicus services, both on the climate change side of things as well as the atmosphere monitoring services. And we've worked with the climate change services at Copernicus to develop a user-friendly interface that would allow anyone without programming skills to actually access the climate projections, for example, for extreme heat waves, the suitability of climate for tiger mosquitoes. So the information is available on the Observatory website, and it's available for regions in Europe. So the local and regional authorities can actually access the data and see how the situation is likely to develop in the region or local authority in the future. We are also working quite closely with member states in the EU and also a few other collaborating countries. And we recently ran a webinar with them in order to find out what are the actual information needs, what topics would be of interest to them that we address through the Observatory, how should we present the data to them. So that's been very useful for us to give us a steer for the future developments. And here here also comes my plea to the audience, because the observatory is only as good as the information and knowledge it holds, and we have a resource catalog that is currently being populated. So if you know of any interesting reports, tools, case studies, please feel free to reach out to us and provide them, and we'll see whether we can include it in the resource catalog for others to learn and to share the knowledge between us. Thank you.
Thank you, Alexandra. I mean, have you been getting a lot of feedback? Has the response been broadly positive?
Yes, overall, and I'm really pleased to hear the recognition also from the European Parliament, and as we heard this morning, it's a lot of recognition, but there is also a lot of expectations. So we are doing our best to populate the observatory with knowledge, to develop the successful partnerships further, and to make sure that we provide the knowledge that is as useful as possible for the member countries, for our partners in the European universe, as well as for the NGOs, local and regional authorities, and so on.
Well, a lot of pressure, I'm sure. Shiga, so the WISE Centre was formed in November 2020, so it's also not quite the same, quite as new, but still relatively early days. So tell us more about your mission, your focus, and how to understand and help governments achieve more inclusive growth and mitigate these environmental impacts on human health. How does that all work together?
Well, thank you very much, Jennifer. Indeed, I mean, we are still in our beginnings in a way, but all the people actually that are involved with the WISE Centre actually are very experienced economists, policy analysts that come from different parts of the OECD, from the parts that have very sound knowledge of the labor market policies, of statistical analysis, of economic analysis, environmental analysis. So what we're really trying to do is to bring together the expertise that is needed to look beyond the financial dimensions of well-being, to look beyond the material concepts, going towards some indicators, the data development that help us inform beyond GDP, if you wish. And to that extent, we are very much advancing on the OECD well-being framework that we have established more than 10 years ago now, to really bring into life the measurement of how different issues, so health aspects, the quality of life, matter for people through the lens of the economists as well, but also for the broader society. And that sense, the WISE Centre does not only connect the data to policies, so we are really bounded in the statistical analysis, but also we are going a little bit further. We are also connecting the business sector with the government sector as well. So what we are doing is extremely important also for thinking how we go around with sustainable financing, with sustainable investment. So taking into consideration not only the financial risks of corporations that they are actually experiencing through the climate change effects, but also other ones that are pertinent more to the social factors as well. And here is something that we are now also exploring brand new approaches such as nowcasting and others to really get more granular data to understand really who is affected by certain policies, so what type of people and who benefits from their effects, but on the other hand also to understand better how these sort of more equity principles connect to more efficiency principles of policies, for example, that are more in the domain of the fiscal policies, the budgetary consideration, and so forth. So in other words, we're really trying to think holistically about what well-being means for people and how to improve their lives. So if you're going back to the slogan of the OECD, better policies for better lives, this is what all is about.
And how difficult is it to get, if you like, politicians or decision makers in government to think beyond GDP as an indicator or a KPI? Because it is very much entrenched, is it not? I mean, and trying to think about other indicators must be a challenge.
Not as much as you would think, actually. There is fantastic opportunity right now. I mean, at the same time, our center is also leading the work on the recovery dashboard. So how to monitor the recovery measures, building back better. So basically going towards restructuring the economies and trying to avoid going to the normal as we used to know it before. So that means that we need to take into consideration different measures at the same time. So not only that the economy needs to be strong, so the strength of it in terms of economic factors, but also it needs to be inclusive, it needs to be green, and needs to be resilient, as has been highlighted before. And here the notion of resilience so far has been very much considered as more economic resilience. But countries more and more, they want to know what else should be factored in. And then when we understand these separate dimensions, how do these dimensions interlink? How do the social factors interlink with environmental considerations? So this is something that they really are eyeing very closely, also in international fora of G7 and G20. I mean, we've seen a big push towards that. So this is a great momentum to seize. And at the same time, we see it mirroring picture in the business sector. So we've been working very closely with businesses over the last 3-4 years in particularly. And also in 2019, for example, we had this Business for Inclusive Growth Coalition that pledged to fight against inequalities even before COVID. But when COVID kicked in, they emphasized the efforts. They immediately reacted and said, look, these are the actions, what we're doing, what our colleague like from Philips has said. That's what we need, the responsiveness. And this is something that we're really seeing taking place.
Well, I will come back to you. I'm going to come back to you and we'll talk a little bit because I want to know, since it's happening at the moment, what you want from the G7. But first, let's indeed hear from Jasper. You mentioned some of the milestones that Philips has already achieved, but tell me more about the initiatives taken on the circular economy element of and the assessment and the mitigation of pollution impacts on health.
Sure, thank you, Jennifer. So about circular economy, it just makes sense, right? Circular economy is about decoupling economic growth from resource consumption. And so it reduces the amount of waste and pollution. As a world, we produce 50 million tons of electronic waste per year. So that's just a ridiculous amount. So it makes business sense to go towards a circular economy because we want to maximize the value of materials in the value chain as long as possible. And in Philips, we do this in 2 ways. So first, we focus on what's already out there in the world. Philips makes different healthcare products, including large medical scanners and other systems that help patients in hospitals around the world. We successfully delivered on our previous pledge to take back those used systems, refurbish them, and then repurpose them in a responsible way. For instance, giving them a second life. And our next commitment is to extend this and to close the loop on all professional equipment. And this then reduces the amount of materials and pollution that ends up in the environment. Now, the second way to drive the circular economy is about creating new circular solutions. And actually yesterday, something exciting happened. The EU Green Consumption Pledge was announced from the EU and several companies, and Philips joined that pledge. So we publicly announced and committed to only introduce new products with ambitious eco-design criteria that go well beyond the legal requirements. So talking about product design. So product design has a huge impact on circular performance and environmental impact. We pioneered something called circular ready design. And that depending on the type of product and business model, the circular ready design uses a couple of design strategies to minimize environmental impacts and get a circular economy going. So one example is, for instance, with sustainable material selection. We avoid harmful substances that would then eventually end up in the environment, in the product design itself, and we also try to use as much, some people call it recycled materials. We like the word secondary raw materials in the product itself. And there's also other smart choices that you can make. For instance, making things easy to clean so they can be reused. Designing products to be easy to disassemble, to repair, and to reassemble. And to employ modular design strategies for forward and backward compatibility, so that extends the lifetime of the devices. And apart from circular-ready design, we also focus on other environmental impacts in our product designs, such as lowering energy use, reducing packaging, using sustainable packaging materials, or reducing weight of the products, because we see that 90% of the environmental footprint from our company is actually from the use phase of our systems. So the biggest impact we can have is actually designing our products in a smart way. Thank you.
Thank you. Well, this circular ready design principle, is this something that you think could be picked up and used by other organizations or other companies?
Oh, absolutely. And that's why the EU is so important, because we drive really a message of harmonization and standardization. So Philips actively works in through trade associations and standardizing organizations to come to a common understanding of what actually circular design means, because then we can actually team up together and also make sure that if this eventually will turn into criteria, let's say you would have governments and hospitals setting certain public procurement criteria, that we have a common understanding of actually what does a circular product mean, what is actually an eco-designed product. So we definitely team up with our knowledge partners.
Yeah, it's wonderful to think about it in terms of all working together. A really sort of circular but also really coordinated ecosystem would be a wonderful aspiration. So let's hope we get there. Maria, I know in the Pulse project you've developed these models to assess and get an idea of the impact of pollution on citizens' health and their exposure to pollution. Can you tell me a bit more about these models, how they work, what is it you're monitoring?
Thank you. It was mentioned by Ms. Sarah before, Cerdas, I think was her surname, in her previous remark that air pollution is correlated and considered a risk factor of many diseases. So in the case of Pulse, it was focused on the link between air pollution and the respiratory disease of asthma, and between physical inactivity and the disease of type 2 diabetes. So the emphasis of Pulse was on environmental and the behavioral risk of those two diseases onset, with a goal to build these extensible models and technologies able to predict, mitigate, and manage public health problems. So within this framework, Pulse developed and tested new models for the prediction of type 2 diabetes and asthma risk onset, taking into account different environmental and behavioral risk factors and considering different scenarios of the different variables to be considered, taking into account those that are easy accessible from the without requiring particular measurements, or those that require non-invasive measurements like heart rate for asthma or blood pressure for type 2 diabetes, and including a third scenario for the case of type 2 diabetes of an invasive measure like glucose concentration. So these models were combined and providing risk scores for both type 2 diabetes. So it provides you probability of developing this disease in the next 8 years. And then in the case of asthma, it provides also a score to develop the disease in the next 5 years. So in addition to these two models, Pulse also developed a 6-dimension scores well-being model based on the well-being and the European Social Survey. And this model was fed using information from questionnaires coming from the citizens using an app. and then activity trackers and air quality sensors. And finally, because one of the aims of the project was to assist and giving citizens personalized feedback to help them to make behavioral choices to reduce the exposure of to air pollutants, we also develop a dynamic personal exposure assessment model using a dense network of low-cost air pollution sensors, the GPS location of the user, and also an estimation of the number of pollutants inhaled by the user. So in addition to all these models, PALS require also the development of different technological components in order to provide and show results in a public health observatory that could provide intervention and policy development and implementation.
And what sort of sample size did you have? Was it easy to get citizens to engage with you? I mean, or did you work through healthcare professionals? How did you find people for the studies?
Yeah, thank you for the question, because you tackle a very difficult point, because as I mentioned, we had 7 different cities, and part of a big part of the project was the recruitment of users. So we had to, even if this was citizen science, the project followed a citizen science approach where participation of the citizens was crucial, because we wanted to not only to have general information, but particular information from the citizens. We follow different strategies in the different cities. So for some of them, we even offer prizes. There were challenges like the 1,000 challenge for step challenge in cities like Singapore or Birmingham, where if you completed this, then you get a prize. And even for some of the users, like in New York, we offer them the activity tracker to the users. So we engage around 2,000 users, so around 300 in each of the cities. And yeah, it was a very difficult process, I have to say.
No doubt. I mean, some of us, of course, we wear a tracker, but that depends very much on the certain sort of part of the population, I guess, you represent. Ziga, I wanted to ask you about the links between inequalities and environmental issues. And you know, you're measuring and monitoring. Do you see different stratas of different people feeling it more or being more engaged with the work you're doing?
Thank you very much. Very good question. Indeed, I mean, we do see that. I mean, it's very important that we look at the issues at the more granular levels. So not only looking at national averages, aggregates, but trying to tease out how it matters for children, how it matters for elderly, how it matters for women, how it matters basically for people depending on their socioeconomic status, but also where they're located, where they operate, where they do their activities actually, and also where they live and what kind of conditions they live, whether they're crowded households or not. And we have some data on that, but honestly, we still need to do much more progress. And this is something that we are really work organizations, I mean, including with the European Environment Agency. I mean, they have fantastic work on air pollution and also by different population groups and so on. And what we are focusing as well on is in developing new methods to interpret and to use better the geospatial information. That's important because once you have geospatial information for air pollution, you can overlay it with different maps. You can very easily see what is the economic activity in that area, or for example, what type of housing prices you have in that area. And this gives you a very strong pattern of whether the socioeconomic situation is sort of responding to environmental challenges or not. So basically, you get more feeling about interactions between them. But what's a big challenge is to get this sort of information timely and very frequently. Often it's very lagged. It's like lagging 2 or 3 years behind. But you know, when we need to inform of crises like COVID, we need to inform it now. And this is something that we've been discussing a lot with countries, and there is huge interest by national statistical offices as well, to come towards developing new approaches to generate data that would help think not only for this current pandemic in this sense, but also be ready to have the tools, the statistical tools available for any future pandemics that will come at some point in time.
Alexandra, I noticed you nodding along, particularly at that point regarding timely data. What has been your experience?
Yes, I can only totally agree with what Zyga is saying, that we do have then very sort of granular environmental data about air pollution, about noise, about climate impacts, accessibility of green spaces, a lot of various environmental aspects. However, the struggle to sort of assess the impact on social vulnerability or the sort of relations with socioeconomic inequalities is finding the socioeconomic data of equal granularity that we could combine together to carry out the assessment. So most of our assessments don't actually go below the sort of regional level where we could get the sort of complete coverage of data from Eurostat. And the currency of data as well sometimes is something that we could definitely improve on, both in terms of the environmental data and the socioeconomic data. So sometimes the long reporting cycles on air pollution and on noise, for example, are a bit of an obstacle. Just to add that from the climate change perspective and the vulnerability of people, sometimes it's very specific. For example, if you imagine a situation where flooding comes, someone who's normally quite capable of leaving the house very quickly and evacuating their belongings, but they happen to have a broken leg at the time, suddenly is much less mobile. So sometimes this vulnerability to climate-related impacts is very sort of specific to a particular period in people's lives, being pregnant, having a broken leg, and so on. So we lack the mechanisms to actually capture that and present it in real time, just to reflect what Zyga was saying. Thank you.
Thank you. Jasper, I think you have something to add to this discussion.
Yeah, I think we're really at the point in time that we can start to connect the different puzzle pieces, right? So when pollution eventually impacts some people to the point that they actually end up in hospitals, then you really start to talk about patients. And there's a revolution going on now with digitalization. So digitalization has reached a point in healthcare where value is shifting from standalone products to really to see solutions, and that's disrupting the healthcare landscape right now. So yeah, if we look at our customers, hospitals, doctors, they're talking about a continuous care, a health continuum, that is encouraging people to take an active role in the management of their own health. So we're not only talking about then treating patients in hospital, but actually moving healthcare also to homes and daily lives with preventative and chronic care services outside of the hospital. And at the same time, we also see consumers and people themselves using mobile devices, wearable monitors, and other technologies, looking for a way to stay healthy. So if people leave a hospital or people with chronic conditions, you really see now health technology leading a way to support recovery, and also potentially to have a change of lifestyle. So I think with the new technology, digitalization, we can start connecting the dots of pollution and impact on health.
Thank you. I mean, I think, in fact, one of the points we want to talk about today is about well-being. It's not necessarily about health at the point of treating sickness. It's this preventative in advance, being better, being well. Now, we've got quite a few questions coming in from the audience. We've got one here from Louis Lostis, who's curious to know what Maria and Zyga believe where the EU Climate and Health Observatory could support their work. Maria, do you have any thoughts on where that could go?
Okay, thank you for the question. I think that one of the points Pals wanted to achieve, and I think that somehow it did, was to have the potential to collect data at individual level on behavior, mobility, etc., that the traditional surveillance systems are unable to gather. So the usual open data that are generated by different organizations are only one source of data. So when this data is supplemented by data that is created by the systems, by the citizens, this can provide better insights and better outcomes. So in this sense, what I think that systems like Pulse, in collaboration with these observatories, can allow the analysis of aggregated data that can support decision-making in different public policies.
Thank you. Ziga, let me, the same question to you. Where can the EU Climate and Health Observatory assist, and what's its value?
Yeah, I mean, maybe just to highlight like 2 points. So one is that we haven't really touched upon yet, but it's extremely important, is actually distinguishing very well between the sources of subjective data, so self-perceived measures. So how do people feel about being exposed to certain environmental threats? How do they feel about policies are affecting them? So we've developed a lot of work on measuring trust, on understanding better the perceptions of people. So this is something that also needs to be taken into consideration when against the statistical data. And another angle that is very important is mapping, of course. This is what Margareta has just mentioned, and this is something that we are working together very well, and we can build on each other's experiences as well. For example, at the OECD, we have frameworks that use that combine different types of data to construct indicators. For example, the green growth indicators framework, we have the environment at a glance, we have the inclusive growth dashboard, going for growth dashboards, and so forth. And most of these dashboards, actually, they do not rely on one single data point, but usually they combine 2 data points in relation to each other. So this sort of experience, and then the experience how to link this sort of indicators to policies directly, it's extremely valuable. And this is something that I think both the OECD, EA, and with the others, we can very well cooperate together also to get a sense of what are the same type of concepts, the same type of methodologies, guidelines that people can use. And people means stakeholders more broadly, so also companies, not only the governments.
Well, thank you for that. I have a question here for Jasper from a Bill Grayson asking, will Philips apply the same circular thinking and recycling to their domestic products?
Yes, absolutely. That's a fantastic question. So we have different circular design strategies that apply differently to the various products in our portfolio. So looking at, I said something about our larger medical systems, where it's really important to extend the lifetime as much as possible, and comparative but different criteria apply to our consumer portfolio. So first of all, making sure that the lifetime is as long as possible, but the focus in consumer products is more on the use of recycled materials and making it easy to repair. So we do actually, as part of the green consumption pledge that was announced yesterday, we'll use a footprint methodology to look actually at the environmental impact of our products. So we can actually optimize our circular design in the areas where it impacts the most. So for our consumer products, that is the use of recycled materials, reducing energy consumption, packaging is super important. So definitely circularity applies a lot to our consumer devices as well, but just with different focal areas compared to our professional portfolio.
Well, thank you very much. Bill also has a second question. I think I'd like the whole panel to answer. He's asking, in general, why does the EU not yet have a system for routinely monitoring the build-up of toxins in the bodies of its own citizens? I think it's quite a broad question and one that this whole panel is seeking to address. But he further mentions that we're not only affected by air pollution, of course. There's a complex mix of chemicals that are in our food and water. So there's a lot of different data points there that I think he is trying to touch on. Alexandra, perhaps you could, I know it's a very overarching question and a lot of different moving parts, but perhaps you could attempt to give us your reaction to that.
I think from what I know that there are attempts to become better at human biomonitoring and monitoring the sort of content of various chemical substances in human bodies. I know that my colleagues from the European Environment Agency are involved in a huge European project called HBM for EU, which stands for Human Biomonitoring for EU, which is aiming to collect the available knowledge and also streamline the approaches to human biomonitoring. It is coming up already with some interesting results as well about, for example, the socio-economic differences when it comes to the buildup of different chemical substances in human bodies. So I will encourage the person who asked the question to search for HBM for EU and find the relevant information there.
Thank you. Zika, do you have anything to add to this question of why we don't have routinely human biomonitoring in the EU?
Well, I'm not particularly the expert on this issue. We do have actually at our Environment Directorate, we have an entire division that actually looks into the chemical basically aspects of the environmental things, and also with that respect, there's a lot of work going on how we test and how do we establish better databases on that. But why we don't yet have it, I think that I would not have the right answer here.
Oh yes, we're none of us politicians here who on this panel. But Maria, perhaps, I know you mentioned that in Pulse you were looking at the air pollution effects on asthma. And I think one of the points that Bill was raising there is that sometimes we focus on certain types of pollution, maybe to the exception of others. Do you think that's a point, or do you think that it's simply that one area deserves more attention than others?
I think in this case, I mean, we, as in every area of research, and Alexandra mentioned that there are other projects trying to work on this aspect. In Pulse, we only concentrated on air pollution as such, because at this moment it was very relevant in the pilots that we were addressing. This was very prominent, let's say, in the population for different reasons and the different areas that were tackled. But it's true that there are other contaminants that also affect the body, causing other diseases, and this is clearly stated in the new European, let's say, program of Europe Beats Cancer, where different areas are identified and that will be addressed in order to diminish or beat cancer in the future. But as us working in this project, we only consider this air pollution effect in this disease, even if we at the beginning only for diabetes, we consider the behavioral, let's say, the sedentarism of the population as a risk factor. Then when we were developing the project, it came out that air pollution was also very relevant in the case of the onset of diabetes type 2. So yeah, there are. I think that there is a lot to do, and obviously, as Sika said, I'm not the expert in this field, but there are programs that in the future we will see definitely tackling this, and maybe in the future a European, let's say, routine monitoring for this.
Jasper, let me ask you to reflect on that particular point regarding the different sorts of pollution that we're discussing. Air pollution does get a lot of airtime, a lot of media headlines, but you know, we also see an increasing awareness of microplastics or other chemical pollutants, but they vary from place to place around the world, do they not?
Yes, exactly. So if you look at the environmental sources of pollution, there's actually three areas that Philips is closely monitoring. So the first of all is obviously from our own operation, right? If you look at our direct emissions that we have to the environment from our own factories, and we have strict rules in place to avoid the use or avoid pollution as much as possible, and to measure, monitor, and report on emissions that we have worldwide. And as a global company, we have just a single policy to make sure that if you have countries with weaker environmental laws, that we at least have the same minimum standards worldwide. And that's the strength of the EU, right, to have also one harmonized approach. We also look at the impact of our supply chain, of our suppliers, to drive them to reduce pollution. And then the third aspect is what actually is then what ends up in the environment through our products. So I know microplastics is really a new topic that we are monitoring very closely, because we see that there's lots of attention rising to it. So I think that will be a next point of attention, I think, in the very near future. Looking at the hazardous substances in general in our products, in Philips, we've already for decades actually have a public set of requirements to go beyond the minimum restrictions like RoHS restrictions, to really drive down the amount of hazardous substances in our products. And we continuously to update that regularly and share that with our suppliers as a requirement. So that really keeps on driving down the pollution or the substances that eventually end up in the environment. And that is kind of the natural fit again with circular economy, right? To even if you have certain substances that are really functional, that have really added value, but at the same time, you don't want to have it end up in the environment, that you make sure that it doesn't end up in landfill, and it actually, you close the loop and make sure that it is recovered and reused.
Well, as a follow-up, I mean, some of these requirements are legally mandated, but of course then some others, and you're going beyond what the floor level is. Do you think that, I mean, there should be more legal pressure on companies, or is it enough to just point them in the right direction and say, this is what you should be doing, but you know your supply chain best or your own business best?
Mm-hmm. Yeah, I think what will have the most beneficial effect is to have a very clear path and roadmap. So it takes a while to design products and to launch them on the market where it will have their impact. And the earlier in the design phase where you can actually make decisions, actually the more efficient it is. So we've already seen that the EU is very effective in providing this roadmap, saying, hey, we want to start banning these substances in a couple of years from now, so we can actually take that into account with product design. But if you would have very sudden changes in regulation, then actually we need to pull away resources that are working on innovation and do all kinds of corrective actions to make sure that we align with the sudden changes. And then as a net effect, we actually have less resources available to work on eco-designed products. So I think having clarity, the right incentives is very important. So I think that if you look at the REACH laws in Europe, I think that's a very clear path where you start with listing the S3HCs that are suspicious. You have reporting, and then once there's more evidence about the actual harm or not about these particular substances, they then move into the phase where it's restrictive. So I think that is key to provide a clear roadmap.
And of course, yes, that all ties into as well this sort of precautionary principle that is held by the EU. Shiga, let me come back to you about building back better and what governments can do to align environmental objectives with broader well-being priorities, including, just not just health, but other considerations in terms of well-being. So what is WISE doing to measure what matters to people beyond GDP?
So we are actually framing our analysis on one side on developing indicators, but actually it's not something that we are doing from scratch. So what we're really after is to have a solid dashboard to inform on strong, inclusive, green and resilient recovery. But important to note here is that actually it should be rather simple to use. It should not have too many indicators. So we are focusing around 20 indicators, 5 per each dimension. And we are looking at the levels that are beyond the aggregates, beyond the statistical averages. For example, we are trying to see exactly what wage gaps matter when we take into consideration gender diversity. When we are looking at income inequality issues that we understand very well by different income cohorts, what it matters. So in other words, we are really focusing on capturing the aspects of the quality dimension of the recovery. So not only the quantity of jobs that would need to be provided, but actually whether or not are we improving the conditions for workers, whether the work is becoming less stressful. Then also we are also need to understand that what is needed is to go really towards something that is more systemic in the nature of transformation. So that means that we are not looking only at one specific sectors, but how it actually interconnects across the sectors. And the big challenge is how to combine different dimensions of strength, inclusiveness, green, and resilience together. So perhaps that's actually the big part that it's also very valuable in the work that we are doing with businesses to connect the social and environmental issues together.
Thank you very much, Shiga. I think that is a lovely wrap-up of your work. We're pretty much running to the end of our event now, so I'm just going to get Alexandra as well and the others to just give me your final thoughts, please.
I think that when it comes to climate change and health, there is still a lot of unknowns, and there is still a lot that we should learn. And I think probably the biggest knowledge gap is about what works best. What solutions are the most effective? What solutions are the most cost efficient? So I think we should be really focusing our efforts on gathering this knowledge and exchanging this knowledge on practical solutions. I think what is also really important is to connect the various communities working on climate change, on health, on other aspects of environmental pollution, make sure that we don't work in silos. And these silos are particularly important at the sort of local authority level where a lot of the solutions are being implemented. So I would really encourage this sort of work in partnership and exchanging knowledge and striving together towards becoming pollution-free and safe from climate change. Thank you.
Thank you. Maria, closing thoughts? Joined up knowledge is obviously the theme that we're hearing from Alexandra. What would be your big takeaway?
Okay, I think that in general, systems like the ones we have been showing during this panel, where we are collecting a lot of heterogeneous information coming from different sources, create scenarios that can contribute to the health promotion and disease prevention in three different areas. So on the one hand, on research, that systems, policies, and stakeholders working together to allow a more precise identification of at-risk populations through more comprehensive understanding of the human health and the disease. So including interaction between genetic, lifestyle, and different environmental determinants of health. Also at the level of surveillance, so enabling better surveillance, not only to non-communicable diseases, but also to communicable diseases like the one we are suffering now. And then finally, at the level of intervention that can facilitate better targeted strategies and different interventions that can improve the health promotion and disease prevention.
Thank you. And then Jasper, last but again not least, give us your closing thoughts before we move on to our final wrap-up.
Yeah, thanks. No, I think looking at the EU, every country, every company is facing constraints in terms of resourcing. So having a fact-based, evidence-based policy to really get the most value out of the effort that we put in. I think that is the best outcome that we can get by working together and sharing knowledge through these kinds of platforms.
Well, thank you very much for a really interesting discussion. We could have talked, I'm sure, a lot longer. We also still had questions in for you that we didn't get a chance to get to. But thank you once again. I'm going to turn now to Veronica Manfredi, Director of Quality of Life at DG Environment, to have the unenviable task of trying to summarise and wrap up for us the main thrust of our discussion today. Veronica, I believe you're there. Can you hear me?
Absolutely, yes, and I can see you, Jennifer.
That's super. I can't see you, but at least we can hear you. I'm sure you've been following the discussion today with interest, so can you give me your thoughts on the main points that were raised and what your hopes are for the future?
Absolutely. Well, first of all, let me say a big thank you to All Policies for a Healthy Europe and Euractiv for a really fascinating discussion, which honestly encourages me in the sense that I hear that the crux of the matter is very much the same crux of the matter we have identified in the Zero Pollution Action Plan. We seem to know a lot about very many different sources of pollution, from air to noise to what contaminates our waters, our seas, our soils, and ultimately plays back bad on our own health and damages our ecosystem. So the challenge is really to pull the strings, secure that we go towards knowledge sharing, which is of a much higher quality. And there, a thought that I thought was coming from one of the panelists, which we fully embrace in the Zero Pollution Action Plan, is the completely untapped potential yet of what digitalization can bring to us. We have reached a degree of maturity today that can let us go much faster in connecting these dots that we need to connect. The European Union has decided with the Zero Pollution Action Plan to identify the EEA, European Environment Agency, who was present at this panel, and the Joint Research Centre as its knowledge center of excellence for zero pollution, which means that these two bodies will have a role in coordinating the many other data sources that, of course, we get also from our very close cooperation with the colleagues from the OECD. So these all seems to bring the dots together. I heard a lot of thoughts about the need to accelerate action to secure more life cycle human biomonitoring. I'm happy to tell you that actually it's since over a couple of years now that we have launched the world's largest network of epidemiologists assessing indeed life cycle impacts of environmental factors on human health. So this is also data sources that we need to put all together. I heard about the importance to secure that we connect the dots across the different Green Deal strands, which is at the core of what we want to do with zero pollution. So circularity, of course, helps in polluting less. Greening our cities in line with biodiversity strategy goes there. Getting our farming much more sustainable, getting pesticides free serves this purpose. The renovation wave will help us to secure better air quality, both outdoor and indoor, throughout, our working also from home, as we do all of us during these pandemic times. So conclusion is, there is a lot to do, but we have already quite a lot in our cupboards, if I may say, and we can just, by uniting our efforts, become so much stronger, so much more resilient. And this is why in the last week at the Green Week event, we have also launched the Zero Pollution Stakeholder Platform. We are now operationalizing it. By this autumn, it will be operational, and I really look forward to have all the companies and all the people that participated to this panel today on board with us. All hands on deck.
All hands on deck indeed, Veronica. Thank you so much. I was very myself struck by last week's Green Week. I presented the Life Awards. The work that's going on is tremendous. And as you say, there's an awful lot of strands that we are pulling together to try and get this joined up thinking, which is what it's all about. So thank you very much for taking the time to talk to us today. I am sure we will continue this discussion in the future. Veronica Manfredi there, Director of Quality of Life at DG Envy. So thank you for joining us. Let me thank again all the panelists who spoke today and the organisers who put this very important panel together. Of course, that's All Policies for a Healthy Europe. And I do want to urge you to continue this discussion well beyond today's event. Use the hashtag Healthy Europe and the hashtag Wellbeing for, the number 4, all, so that you can have an ongoing debate about what is needed in the future as we build back better from the COVID crisis. It's a real pleasure to talk to so many experts about things that they really know about, so do make sure you keep doing that. With that, I will thank you, the audience, for your questions and your comments. We do appreciate that you tuned in and sent your suggestions. So we will be back with more in the future, so do stay tuned to Euractiv. Thank you very much and have a wonderful Friday.